Hello, it's Dr. Rhonda Johnson. Today's Wednesday, June 22nd, 2022. Today I'm talking about how you can have a negative rapid home COVID test and still be infected. Well, folks, you have sneezing, runny nose, scratchy throat, feeling achy. You say to yourself, oh, I hope it's not COVID. I know it's not COVID. It's just a cold or allergies. But just to be sure, you do the rapid home test and it's negative. You breathe a sigh of relief, but does that really mean you don't have COVID? Well, the truth is you can still have COVID and test negative, and days later your test can turn positive. Meanwhile, you've exposed others. What's going on? Well, here are some possibilities. Number one is that the test may have been done incorrectly. You know that thing called user error? Be sure to follow the instructions in the test kit, even if you're used to doing them by now, because every test kit made by different manufacturers can be a little different. Number two, check the expiration date. Experts say expired tests can be useful for a time, but there's no consensus on exactly how long. Three, it could just be a bad test. There aren't always quality products out there, and the tests are accurate 80% of the time, according to some experts. Number four, rapid tests may not pick up very low viral loads in the nose. Still, 3 years into this pandemic, no one really seems to know how much virus you need for it to be infectious. But you could still transmit at very low viral loads to someone you're in close contact with, even if your rapid test is negative. Number five, we can blame it on the Omicron variant. Some experts say these rapid antigen tests are just as accurate for Omicron and subvariants. Others say they're less accurate. I don't know the answer to that. But here's a little common sense advice. Repeat, repeat, repeat. If your rapid test is negative, you've been exposed, you have some symptoms, repeat the test in a couple of days and wear a mask in public. Should you get a PCR test? I say yes. Now, remember, if your rapid antigen test or your PCR test is positive, that means the virus is present in your body. A positive rapid antigen test means you are infectious and you can transmit your COVID infection to somebody else. Now, it always pays to remember that there are so many variables with COVID. Some people get sick quickly, some people never seem to be infected, even when they're around infected people. Things like age, genetics, the dose of the virus that gets into your body, that's called viral load, vaccination status, all can play a role. So always consult with your healthcare provider. It gets to be a little bit confusing sometimes. Now, so what did I talk about this session? In summary, if your rapid test is negative and it's early in terms of your exposure to someone with COVID or you're having symptoms, don't trust the negative result. Repeat the test in a couple of days. You can get a PCR test. If that's negative and your rapid antigen test is negative, you are negative at that time. Now remember also, you can get your free home test by ordering from the website covid.gov.tests or call 1-800-232-0233. And that's my message today. Take care and be safe.